The behavioral coach role and setting SMART goals. Review these course objectives and then select the. Most participants may not have experience setting goals for themselves. They may need help identifying areas to work on. It might be helpful to engage them in a discussion about desired changes and help them formulate the next steps towards success. SMART, S-M-A-R-T, is a well-established tool that is used at Able 2 by providers and participants to support treatment planning, treatment sessions, and program completion. It is a framework of 5 elements to guide goal creation. The purpose of utilizing the SMART goal framework is to clarify ideas with the participant and to focus their efforts while setting goals. This is a productive use of time and resources. Also, it is shown to increase chances of meeting goals if they're created using the SMART framework. Select each letter of the SMART acronym to see what element is represented. Select each element to hear a description. Specific means that the goal clearly defines what the participant wants to achieve. Measurable means the goal establishes how success in attaining that goal will be measured. Achievable means that the goal is realistic and attainable considering such factors as resources, time, and support needed. Relevant means the goal aligns with the overall objective for treatment. Time-bound sets a time frame for achieving the goal or completing action steps. To co-create goals and objectives with the participant, ask questions associated with each element. Select each element to see examples of questions to ask. Providers should keep some things in mind about each of the elements when co-creating goals with participants. Click again on each element for details. Clarity in goal setting supports participants with the motivation and focus they need in order to take action and be successful. Let's check your knowledge so far. In Coaching Plus, behavioral coaches utilize the SMART framework to create short-term coaching-specific goals. These goals are co-created along with the participant and support the overall purpose for coming to the program. In Therapy 360, the participant's care team will collaborate to develop goals. Therapists complete a treatment plan in Session 1A, which includes long-term goals and short-term objectives. Then, in 1B, everyone on the care team utilizes the SMART framework. Therapists use it in 1A. There are many people collaborating to create meaningful goals. Click each button below to learn more about each person's role. The participant is involved in the creation of goals that are meaningful to them. The therapist prompts goal creation with the participant and modifies them as needed. The behavioral coach works with the participant to create short-term coaching-specific goals that support the treatment plan. External support. The best practice is to involve the entire care team, such as the participant's PCP and/or health plan care manager when applicable. To assist in goal creation, both the therapist and next, you will complete an activity using the SMART framework. During the activity, you may reference associated job aids by clicking on these boxes. The job aids will open in a new tab. They are also available throughout this training by selecting the Resources tab. Knowing that behavioral coaches use the SMART framework during Session 1B, Let's see if you can pinpoint how to best support the treatment plan. Which of the following short-term goals would be appropriate for the 1B session with the behavioral coach? Behavioral coaches document the co-created short-term coaching goals in the Finish Up section. The following are some examples of good documentation practices. Click each button below to learn more. Both therapists and coaches should always read the previous session notes in order to continue the treatment plan, build on short-term goals, and/or create new goals based on the participant's presentation. During coaching session 3B, participant Olivia says,
I realize it's been a few days since I took my lisinopril. I have a PCP but have not told him about this problem.
What should the coach do? Choose your answer from the buttons below. These answers are both correct. It is best practice to collaborate